And Urban Private Hospitals Association, Rupha, is accusing the Social Health Authority of deliberately trying to cripple private hospitals through non-payment of claims. They allege SHA automatically rejects claims from private and faith-based facilities while prioritizing payments to public hospitals. The hospitals warn that unpaid claims running into billions of shillings have crippled their operations, with many now on the brink of collapse if payments are not released soon. Mary Moki with those developments.
When the Social Health Authority was unveiled, the government promised a robust digital system to end fraud and guarantee timely payments. But fresh figures and mounting complaints from private hospitals tell a different story. According to the Rural and Urban Private Hospitals Association, between October last year and August this year, hospitals submitted claims worth more than 93 billion shillings. Only about 50 billion shillings has been paid out, leaving a massive 43 billion shillings unpaid. For private and faith-based hospitals, the situation is dire. They accuse the government of deliberately prioritizing public hospitals, while more than 600 private facilities have gone without payments for months. The Rural and Urban Hospitals Association, Rupha, terms this as a deliberate ploy by the government to sink private and faith-based hospitals in the country.
This payment of 19.9 million shillings is because this particular facility had missed payments for a few months, about 6 months. This flies in the face of the digitization push that the Cabinet Secretary has been talking about. This whole idea that it was a genuine mistake is a lie. It was not a mistake. It was deliberate, and it is what has been happening.
SHA data shows that inpatient services account for more than 81 million visits across over 3,000 providers. Yet, private hospitals say many of these claims remain unsettled, forcing them to operate under mounting debt. Outpatient and emergency services have also been hit, with outpatient claims worth over 12 billion shillings still hanging in the balance. This week, the Social Health Authority was forced to explain how Nyandiwa Dispensary, a facility said to be non-existent, received a 20 million shilling payout. The SHA CEO insisted the dispensary had been upgraded to a level 4 hospital but retained its old bank account under the dispensary's name. Critics argue the case exposes a manual system open to human interference despite claims of digitization.
If a private healthcare facility is generating sufficient patient visits, there is an instruction that has been given to Savannah Informatics to put the claims from that private or faith-based facility in hold or reject, because of the need to protect or to enhance the equipment project that was launched the other day, away from private and faith-based facilities, which serve more than 50% of Kenyans.
Although 23 million Kenyans are enrolled under SHA, only 4.4 million are actively contributing. The fund is already running a 3 billion shilling monthly shortfall, placing the burden of universal health coverage on a small fraction of Kenyans. Experts warn the government must urgently rethink the model to ensure all enrolled members contribute. Private facilities have given the government until September 23rd to settle payments or face unspecified action. Mary Moki, Citizen TV.